Having uncontrolled diabetes leads to symptoms and diabetes complications. It's important to monitor our glucose levels in order to prevent complications from occurring. Every person has different target glucose levels. Your doctor may need to add medications to your treatment plan if blood glucose levels or hemoglobin A1Cs are not at goal. Early on, diabetes can be managed with diet and lifestyle for many patients. However, it is extremely common for patients to require medications and even more than one medication as time progresses. Some medicines decrease production of glucose from the liver. There are medicines that allow the body to secrete more insulin. There are medicines that make the body more sensitive to insulin. Medications are also available to allow glucose to be secreted in the urine, and then there's insulin. Some patients may require the addition of insulin or transition to insulin during the course of diabetes. This often occurs if patients are taking 2 to 3 oral medicines and having glucose levels or hemoglobin A1C levels that are above goal. Sometimes oral medications get glucose levels well controlled. Despite this, insulin may be needed in certain scenarios. For example, if there is an infection, if there is pregnancy, during hospitalizations, or if medications like steroid cause glucose levels to be very high, insulin may be needed. An important part of the management of type 2 diabetes goes beyond just getting glucose levels under control. It requires risk reduction strategies, and in those cases, we may offer patients non-diabetes medicines to prevent the risk of complications. For example, commonly used or prescribed medications are classes of meds called ACE inhibitors or angiotensin receptor blockers. These are typically blood pressure medications that have kidney protective benefit. Sometimes we often prescribe or recommend that patients take cholesterol medicines known as statins. We prescribe statins in order to prevent cardiovascular disease from occurring. Ultimately, if there are questions or concerns, I ask patients to discuss them openly.